what was that experience like in 2006 when the Board of Health decided to terminate your contract as the health officer?
Well, it wasn't a great experience. I very much enjoyed the job. There was conflict with the board. My situation was a little, my relationship, my formal relationship, the organizational relationship was different than Dr. Lutz's. I was the director of the health district as well as the health officer, and I reported directly to the board. And so there was conflict, as it's been called in the media in the case of Dr. Lutz, administrative conflict. It was over disagreements in terms of my doing my public health responsibilities, and the board being mostly elected officials sometimes didn't like what public health did to some of their constituents. So that's really the crux of the conflict. It's the same as the conflict that Dr. Lutz is facing.
You mentioned the board made up mostly of elected officials, kind of the same situation we're in now, but what were some of those things at the time that they didn't agree with?
A lot of the disagreement was around food safety. The health district is responsible for ensuring food safety in restaurants, and there was a lot of conflict around that often.
Gotcha. And so,
although we also had we had outbreaks. We did have some restaurant outbreaks. Those would lead to concern. There was also conflict over mandatory vaccinations in refugees. There were public health functions that we needed to carry out, and the politicians would hear from their constituents, and it would lead to conflict.
So then, I guess at the time, the spokesman had reported, and you kind of touched on this, but at the time, the spokesman reported the board agreed to your termination without cause or complaint about your professional credentials and public health performance. So now, 14 years later, what do you think about this?
Deja vu.
How do you mean?
I think it's very, very similar. Dr. Lutz and I are colleagues, and so we communicate. We've discussed the difficulties of board governance with elected officials as the major portion of the board.
Is it frustrating to you to see this now happen once again? You mentioned it's very similar to what you experienced, and now similarly happening to Dr. Lutz. Is that frustrating for you?
Well, frustrating is one word. Irritating, alarming, bad for the community.
Why is it bad for the community?
Because Dr. Lutz, when I was health officer, our interest is the health of the community. We're professionals trained, we're physicians who are trained in public health. And what public health does is protect and promote the health of the community. And in the midst of a pandemic, what your responsibility is to protect the health of the community. Dr. Lutz was staying entirely on top of the best science available. As we know, this has been evolving. We've been learning more. He's been staying on top of it, and he's been out doing everything he should have been doing to protect the health of the community in the midst of a pandemic. And it's unfortunate that it's become so partisan. 9 months into this, we're all exhausted about what we need to do. It shouldn't be so difficult, really, wearing a mask, social distancing, avoiding large gatherings, washing our hands regularly. Those shouldn't be all that difficult, but it does require a collective response, and some people don't want to do it. It's unfortunate, and apparently those are the folks who our politicians are listening to.
So it sounds like historically the Board of Health or administration is at odds with the health officer. We saw that in your experience and what we've learned so far in our current situation with Dr. Lutz. So what do you make of this? Why do you think that is?
Well, it really is the history of health officers and boards of health. They're very, very old governmental entities. They actually predate the foundation of our republic. And health officers have always had a tremendous amount of authority when there's, particularly in the face of a public health crisis. And the idea of the health boards was to put a brake on that, to provide some controls. It's really become antiquated because there are other checks and balances that exist on governmental authorities in contemporary times. So many jurisdictions, not Washington, but there are states, have really gotten rid of health boards and because they're not as needed anymore, and they can result in something like this, which I think is really a tragedy and perhaps dangerous for our community. After I was fired, it took 2 years to replace the health officer. There are not a lot of trained public health physicians. And, it's hard to see somebody wanting to come into a position like this. So we could be left without a well-trained public health officer. And this has been happening across the nation during the pandemic. This is a stressful time for these leaders, and so we're losing them. To not have that professional expertise at a time of crisis like this is, at a minimum, a tragedy, and it may be a catastrophe.
Is there any possible reason, you mentioned being colleagues with Dr. Lutz, is there any reason you can imagine that could justify their reasoning behind asking for his resignation?
No. No, I think it's political. It was political in my case, and I mean, the reason given in my case was they wanted to take the health district in a different direction. That's kind of scary.
Do you think that might be the case again in this situation?
Yeah. I mean, they've made changes since to accomplish this, really, developing that administrator position in between the board and the health officer. Now they can sort of try to push that off on Clark of what's going on. It gives them a buffer, a political buffer, it seems like.
Do you think that it was brought up in the Friday press conference, which I'll ask you about here in a moment, but it was brought up that the curiosity of, is this the board's way of segueing into completely removing a health officer? I wonder if you have thoughts on that.
Well, it's a statutory position. You can't have a local health jurisdiction in the state without a health officer. And there are statutory provisions of the relationship of the health officer to the board, how the health officer can be hired, how the health officer can be fired. In Washington, the health officer is supposed to be an MD with a master's in public health. And there just aren't a whole lot of us.
So I hope you could give us maybe a little more perspective. What was it like being a medical voice on the board during your time as health officer?
Well, as a professional with a professional code of ethics and professional and a mission-driven practice, I had pretty clear guidance from my profession per se, and that's how I was going to make decisions and guide my practice. So that's where the tension rises, because it's not always what a political leader wants. So I always said, well, I was a scientist practicing in a highly political setting. And there are, that's kind of the situation that occurs as a government employee, a scientist working in government.
So it sounds like at the time, even in this position at any time, it sounds like it's a position where you're doing what you know based on your profession and for the good of the public's health, kind of going up against what maybe political leaders would like to see happen.
Yes, that's what it feels like. Yeah.
That can't be easy.
No.
So I do want to kind of move to the Friday press conference. Did you have a chance to tune into that on Friday?
No, I haven't seen it. I've heard about it.
Okay. Well, at this point, Dr. Lutz has issued a statement saying he's hired a lawyer. He has plans, or he has no plans to resign, fighting to keep that post. So the board is now saying it will be taking a public vote on this. How do you see this playing out?
Well, I don't know what the board's going to do. When in my situation, it was fairly similar. I had an attorney, and by law, as I said, there's statutes that guide the board's relation with the health officer, and they hire the health officer and they can terminate the health officer. By law, they have to hold that public they have to hold a public hearing. So the board in my case moved to dismiss me, and my lawyer reminded them of the law, so they had to go back and hold this public hearing. So they had a public hearing. It was well attended. They actually had to move it to the county commission hearing room, and there was a lot of public testimony. I made a statement, and then they went into executive session, came back out and said they were firing me. So, but I mean, I don't know what these guys are going to do.
Did at the time you mentioned public testimony, did it seem like there was a lot of support from the community to keep you on in your position?
The testimony was entirely favorable.
When I was looking at previous reports of what you had gone through, gosh, it really does. I think I call it the right deal, a deja vu, the community coming out in support of and being just very disappointed in the board's decision and not clearly understanding why. I think right now the community is really under this cloud of confusion as to why it came to the decision to ask Dr. Lutz to resign, and almost, again, that deja vu to looking back before at your situation. I guess what can you speculate on that and where we are? Just do you agree with how the board has been handling it? Because there have been a lot of answers.
No, well, I don't agree with what the board has done. I mean, here we are in the midst of a public health crisis that Dr. Lutz has led the response on well. He's done a good job for 9 months. It's going to go on. We're not anywhere close to having this over. To think that they can change leadership in the middle of it is just ludicrous.
And you mentioned it took, after being fired, it took the board about 2 years to find a replacement.
Correct.
Do you see it taking that long, maybe even longer in our situation if it comes down to it?
Well, certainly to find somebody qualified, I think it's highly possible. I mean, who would want to? A good, well-qualified public health professional, a physician, would be crazy.
Yeah, definitely. Looking back at my notes here, what do you think about how the board has handled this situation? I know you obviously you don't agree with what they've done, but how do you feel about the way they've handled the last few days?
Well, I don't think they've been very forthcoming. They don't want to be forthcoming.
Does that strike you as odd?
Well, no, it strikes me as typical of politicians.
Is there anything else you'd like to add on kind of where we're at? I know you mentioned at the time you had been kind of in your own, I guess, whirlwind of health issues in the community. You mentioned there were some outbreaks in restaurants. There was some discussion on, was it vaccines that you had mentioned?
Yes.
Oh, mandatory vaccinations. I might argue that maybe those pale in comparison to the pandemic, maybe, but
yes, you bet.
Yeah. So kind of I guess any other sort of perspective you can give to folks, kind of where we're at. I mean,
well, I urge the community to continue to show their support, and hopefully, since I believe strongly this is a political act that's being taken, let's show our political support for Dr. Lutz, and try to prevent this from happening. It's catastrophic if it does. If they go through with getting rid of a well-qualified health officer who has provided outstanding leadership through this pandemic, it's just hard to think about. So I urge the community to continue to show their support. The medical community has stepped forward and showed its support because he's worked with them closely through this. So I think it's just important that we continue to express that.
Because of the history with your experience and now with Dr. Lutz, what sort of changes do you think maybe need to be made internally to ensure there are checks and balances and transparency when decisions like this are made?
Well, the only thing that I've thought about, and I thought about it long before I was fired even, was to change local health boards. It's a political hot potato. The county commissioners, who by law in Washington are health boards in the constitutional counties, they're going to resist that. So it's a political challenge. There was a bill introduced several years ago, but it went nowhere, to change health boards to be made up of constituents with some expertise. For example, the medical society appoints a person, nursing association, the public health association. That's a model that's fairly common in places that retain health boards. There are places that have completely eliminated health boards. There are states that have gotten rid of health boards. But
Do you know
I
off
think
the top of your head?
Well, I moved here from Hawaii. It had a state health board, but it didn't have local health boards. And that's often the model to have a state health board, and we do have a state health board, and not have local health boards to have a different kind of reporting.
Okay. So
I also think,
suggest, oh, go ahead.
well, I very much support the physician director of health departments. When I arrived in '97, there were several local health jurisdictions in Washington state that still had physician directors, but little by little that's changed, and they put administrators in charge. I very much support physician directors as the model, and the change in the health boards. Otherwise, I mean, here it's only been what, 14 years, and here we are just seeing it again.
And what do you mean specifically by changing health boards? By changing the structure to lean more towards health experts?
Yes, changing the structure of the health boards.
Yes. Would you say maybe eliminating political incorporation completely, or?
Well, I think it's pretty common to have a county commissioner or a city council person or something like that on these mixed boards, but not to have it be ex officio county commissioners.
What do you think why that change, putting more of an emphasis on health experts on the board? What benefit would that have?
I think that they would have more of the interest of public health, and more knowledge about what's needed to protect and promote the health of the community, which is the role of public health.
I think that hits it on the head, Kim. Thank you so much. Is there anything else that you'd like to add that I didn't ask you?
I can't think of anything else, Amanda.
Okay. Well, thank you so much. Before I have you go, I was wondering if I could just confirm how many years did you serve as you mentioned director as well as the health officer? How long was that for you?
It was just short of 10 years, just under. I started in, I believe it was May of '97, and I think I was fired November of 2006.
And you said it was about a slightly different position. It was health officer and director of health.
Director of the health district. Yeah, I was like the CEO and the health officer, and Amelia Clark now is that CEO.
Okay, so that director of health, the health district, transition to the administrator.
Yeah.
Okay.